Hello, 7th standard. Welcome back to this video session. Today we are going to do video number 20. We have been doing Unit 6 Health and Hygiene. We have started discussing two worksheets. We have done previous session 4 worksheets and QB of Health and Hygiene. And next one test health and hygiene lesson we have done 10 questions. Define health, explain inverted triangle, explain this given figure, explain this given figure in relation to health. I hope you remember this is physical, mental or psychological and social well-being. And then what does hygiene refer to? What is personal hygiene? What happens to the person who is affected by cold and flu? That is given in page 84. What is it? When you have cold and flu, you may also have running nose, cough, sore throat and sometimes fever or pain in the joints. For some, this condition may lead to mild diarrhea. This is symptoms or what happened to person who is affected by cold and flu. Then what is community? Page 66. Then what are the uses of mastication? repeat பண்றேன். What are the uses of mastication? Page 85 in our textbook. The physical act of chewing food promotes saliva and gastric secretion which helps in digestion. What is it? The physical act of the physical act of saliva, physical act of chewing food, physical act of chewing food is and tasting food and tasting is called mastication. Tasting is called mastication. நம்ம சாதம் சவைக்கிறதே சொல்லுவோம் இல்லையா, சாதம் நல்லா சவைச்சு சாப்பிட்றோம்னு சொல்லுவோம் இல்லையா, பல்லால் கடிச்சு சவைச்சு சாப்பிட்றது mastication. Physical act of chewing food and tasting is called mastication. Okay, and for mastication teeth is also essential, right? Then tablet disease affecting the teeth. அதுவும் பேஜ் 85 இருக்கு. என்னெல்லாம்? டென்டல் டிகே, டூத் டிகே, பெரிடான்டிஸ். பெரிடான்டிஸ்னா என்ன சொன்னேன், பல்லுல கற்பாகல அதான் பெரிடான்டிஸ். ஸ்பெஷலி இந்த வெத்தலை போடுறவா, பான் போடுறவா, பல்லுல ஒழுங்கா சாப்பிட்ட உடனே வாஷ் பண்ணாதவங்களுக்குலாம் அது வரும். அண்ட் ஸ்கர்வி. ஸ்கர்வினா டியூ டு விட்டமின் சி டெஃபிஷியன்சி the bleeding gums சொல்லுவாங்க, அதுதான் scurvy. இதெல்லாம் dental diseases, right? Then what are the ways to have healthy disease? You will brush twice a day to prevent formation of tartar and plague. Tartarனா இந்த பல்லுல இந்த மஞ்சள் கரையா ஒட்டிக்கும், அதுதான் tartar. Plagueனா இந்த கருப்பா, மஞ்சளும் கருப்புமா பல்லுல வரதா plague. சொத்த பல்லு சொல்லுவோம்ல, அதுதான் plague. Tablet disease affecting the eye and the remedial measures. Page 87. Another night blindness, color blindness. Vitamin A deficiency nala night blindness, person is unable to see in the dim light. Color blindness, person is unable to see the distinguish the color between red, blue, green and so on. That is color blindness. Okay, then what is a disease? Nariya படிச்சாச்சு இது. A disease is a functional or physical change from normal state that affects the health of a person causing disability or discomfort. The reason சொல்லியாச்சுல infection caused by disease causing microbe, lack of balanced diet, poor lifestyle and unhealthy habit, malfunctioning of one or more body parts or organs. I hope you understand. Then communicable disease, we have already learnt. It is disease spread through direct or indirect through the particles of the affected person. Example, common cold, TB, typhoid. Then expansion of ECG, BCG, Bacillus calamic guarin, and not direct observation treatment. Right? The next question, what is vaccine? Next question, what is vaccine? Vaccine is a biological preparation. Vaccine is a biological preparation. Vaccine is a biological preparation that provides active acquired immunity. That provides active acquired immunity to a particular disease. And example, BCG vaccine. Example, BCG vaccine, polio vaccine, and MMR vaccine. MMR na measles, mumps, and rubella virus. Okay, vaccine over. I hope you can understand this. Vaccine. What is a vaccine? Vaccine is a biological preparation that provides active acquired immunity. Immunity na நோய் எதிர்ப்பு சக்தி சொல்லுங்க, அது immunity. Our body has immune system which can fight against the diseases or which can fight against any foreign particles that enter our body. When any foreign particle that enters our body, they are called antigens. Any foreign particles that enter our body, they are called antigens. Okay. So once it enters our body into the blood, our blood will produce a substance called antibodies. Our blood will produce a substance called antibodies, and that will kill the foreign particle. So this is antigen antibody. Actually, lock and key mechanism. In the key, ulla poyiduna idu vandu lock aanidum. Sorkave okay, it will be destroyed. So antigen and antibodies that will work together when any foreign particles enter our body, that is antigen, and immediately the blood will produce a chemical substance, that is antibodies. This is mainly by the WBC, white blood corpuscles. So vaccine is a biological preparation that provides active acquired immunity. So that immunity should be in our birth. By birth, our body should have immunity. That is natural immunity. And nowadays, as days pass on, there are various scientific advancements to prevent the disease. நமக்கு எது எப்போ என்ன யாருக்கு என்ன வியாதி வரும் தெரியாது. So to prevent that, there are different stages of giving vaccine. So another active acquired immunity. Acquired after birth, when the immune system is improved, that is active acquired immunity. Vaccine is BCG, Bacillus calamic guarin for TB. Polio vaccine, it is oral polio vaccine. Polio that is polio drops Then MMR vaccine அது வந்து 3 disease prevent பண்ணும். Measles, mumps and rubella. Okay. So vaccine is a biological preparation that provides active acquired immunity. This is a definition for vaccine. I hope you are able to follow this. சரியா? The next one, what are non-communicable diseases? Non-communicable diseases are not caused by pathogens and cannot be passed on by a sick person to a healthy person. Example, anemia, arthritis. சரியா? Then name the mode of transmission of communicable diseases as air, water and direct or indirect contacts. நம்ம படிச்சிருக்கோம்ல airborne diseases, waterborne diseases. Airborne diseases can be caused by viruses or bacteria. Same way, waterborne diseases can also be transmitted by bacteria and viruses. These are all mode of transmission. I hope you understand. The next one, write the causative agents for tuberculosis. Causative agents for tuberculosis. அதாவது ஷார்ட்டா TB சொல்லுவோம். As mycobacterium. It is Mycobacterium tuberculosis. It is Mycobacterium tuberculosis. Name of the bacterium. Bacteria plural, bacterium singular. சரியா? The next one, cholera is caused by Vibrio cholerae. Cholera is caused by Vibrio cholerae. Vibrio is comma-shaped bacterium. இது ரெண்டுமே bacterial disease. Okay. The third one, again bacterial disease, typhoid. It is Salmonella typhi. Salmonella typhi. PHI. Salmonella typhi. It is a causative agent for typhoid. So, what are the causative agents for TB? TB is tuberculosis, Mycobacterium tuberculosis, cholera Vibrio cholerae, typhoid Salmonella typhi. I hope you understand. The next one, why is the first aid essential? First aid is essential to save the life. When any person is hurt or injured, a normal person should immediately attend to the person who is hurt. That is first aid. Okay, to save the life, to prevent further bleeding and determine the condition of the patient, to relieve the pain, to provide medical care available at the earliest. I hope you understand. Then write a note on leukoderma. Leukoderma, it is a non-communicable disease. It is given in our book page 91. Leukoderma is a non-communicable disease caused by partial or total loss of pigmentation in the skin. Our skin color that is having a pigment called melanin. When that melanin is not functioning properly, then people will be having the உடம்புல வெள்ளையா இருக்கும் leprosy சொல்ல மாட்டா, it is a type. சரியா? That is leukoderma. That non-partial or total loss of melanin pigment. This condition affects at any age, gender, male or female, and ethnicity. And the condition there is no cure. Yeah, but it does not spread by touching, sharing food or sitting together, because it is a non-communicable disease done due to the impairment in the body functioning. And production of melanin pigment. Actually, the gene which is responsible for the formation of skin color, it is not dominant. So, coloration is depressed, suppressed. Then, number brief answers, bookler. What are the steps you follow to keep the teeth healthy? Bookler, the oral hygiene paragraph. Notes on cholera on the page 88, 89. Typhoid on the page 89. I hope you are able to follow this. We will continue. We are with the leukoderma. What is given in our page 91. Leukoderma is a non-communicable disease caused by partial or total loss of pigmentation in the skin. Pigmentation is another skin pigment on the melanin pigment. Then brief answers, just note paniko, you will have been given the QB also, just follow. Steps that we follow to keep the teeth healthy, 9 points kudukken padi. Notes on cholera, you will learn page 88, 89, cholera of the details. Typhoid, page 89. Causes and symptoms of chickenpox, page 90. Then anemia, page 91, 92. Anemia, it is a condition due to lack of RBC. RBC is red blood corpuscles, right? Detailed answer. The hair is thin, the sparse and loss very often. Suggested ideas to reduce the problem. Answer Kutukian. Okay. The detailed account on TB, page 88. Rabies, page 90. Problems caused due to non-communicable disease, page 91. First aid on the page 93. This is the detailed answer. Choose the correct answer. In booklet, tick paniko. First choose option B, health. Second option, third option C, mind. Third on the C, clean. Fourth C, tuberculosis. Fifth one to relieve pain. Then fill in the blanks. First one community. Second blank third windows. Fourth oil. Fifth one mycobacterium tuberculosis. State true or false. First true. Second false. Third and fourth one true. Fifth one false. I hope you can learn. So after test question you will have you will have this lesson, health and hygiene and reproduction in plants and the modifications of plants include pannuve. I hope you remember. Then worksheet 7 நம்ம அன்னைக்கு பார்த்துட்டோம். இருந்தாலும் ஒரு sum up மட்டும் பண்ணுறேன். Give one word, root growing from region other than underground adventitious. Type of root seen in beetle and pepper, it is climbing root. Match the following: mushroom reproducing by conidia, yeast budding. Rock roots are modified to provide mechanical support as seen in banyan. It will grow vertically from horizontal branches of a tree. Then Abyssinia, breathing root of Nematophores Solangia. Okay. Then epiphytic root, and that you will remember. Okay. In the Abyssinia, I hope you remember. This is Abyssinia leaf, and then this is root system. This is normal root. In the normal root, hanging root or epiphytic root will be Abyssinia. The blue color development root. The hanging or epiphytic root development root. I hope you understand. Then 8 again already சொல்லியாச்சு. Scientific name of Valnare centella. Modification in wild strawberry. It is subaerial stem modification stolon. Ginger, rhizome, Iconia offset. Then calm or colocasia is a underground stem which is a condensed form of rhizome. Example, where leaf tip is modified into tendril, gloriosa superba. Then sucker is a short and weak stemmed branch that grows diagonally upward and directly give rise to a new shoot. Example, chrysanthemum. Okay. Then last one is opuntia. It is a cactus plant. And that diagram also already I gave, but still understand this is opuntia cactus plant, where the stem is doing the function of photosynthesis. It is, the leaves are reduced to spines. And opuntia, it is an example for phylloclad. When the stem does the function of photosynthesis, it is called phylloclad. I hope you understand. To sum up video, this one we have done health and hygiene QB with the worksheet discussion. The QB what the question answers we have just done a glance discussion. Main, you should know mastication, vaccine and causative agents for TB, cholera and typhoid. Vaccine is a biological preparation that provides active acquired immunity. I repeat, vaccine is a biological preparation that provides active acquired immunity. Active acquired immunity na immunity which is acquired after birth through the vaccine. Vaccine example, BCG, Bacillus, Calamic, Guarin and polio drops. And another one MMR, where it is for measles, mumps, and rubella. It is a viral disease. Viral disease. Then TB, causative agent, mycobacterium, tuberculosis, cholera, Vibrio cholerae, typhoid, salmonella, typhi. I hope you understand. Correct? So, shall we continue in the next video session? Please go through the QB and worksheet up to 10. Then we will continue. Next, we will have the lesson with the root modifications of plant health, root, stem and leaf. That lesson we will discuss. Thank you. Hello, 7th standard. This is a continuation of our video 20 only. Some pictures that I seen recently in 1 or 2, 3 files I would like to share with you. This is again continuation of health and hygiene, what we have learned in a previous session, video session. We have learned and done some revision with the worksheets that we are going to continue. Right? Now this one is what is personal hygiene. We have the question bank answers. What is personal hygiene and what are the ways of maintaining our hygienic body? As brush your teeth at least twice a day. Then you have to take bath if possible. Daily you have to take bath and if possible twice a day. And you have to wash your hair regularly. That you need to maintain personal hygiene. Then wash your hands and face regularly. First, you should take bath daily. You should wash your hands often, regularly. And then you should wash your face and hands. As such, to maintain personal hygiene, you need to do. But now, as we are in COVID-19 lockdown period, you have to wash 4 or 5 times daily. Then this is food covered with the lid. You should always keep our food covered. We should not leave it uncovered because there are chances for vectors to sit on the food, especially houseflies. It will sit on the food. There are chances for carrying the pathogens that will cause diseases. Then washing clothes and clean uniform. You have to maintain your uniform properly. This is our personal hygiene. Okay, so what is a personal hygiene? In the pictures, daily habit, keeping ourselves clean, you have to write. Okay, then this one, observe the picture and answer the question. This picture composition. Observe the picture and answer the question. What will happen if cold affected friend or classmate of you sneezes or cough in front of you? என்னெல்லாம் இருக்கு பாரு. In this area, small droplets are vaporized into fine mist. இந்த ஆளு தும்மவும் செய்யறான், இருமவும் செய்யறான். அப்ப எவ்வளவு இந்த black and red spots carrying the pathogen. This is causing pathogen. So large droplets settle on the ground within few seconds. எல்லாம் வந்துடும். In this area, small droplets are vaporized into fine mist. Mist அந்த மாதிரி drop வந்துடும் இல்லையா, பனித்துளி மாதிரி. சரியா? அப்போ mist remains in the air for several minutes to few hours. நம்ம சுத்தி அது இருந்துட்டே இருக்கும். அதனால இப்ப கொரோனால கூட சொல்லிருக்கேன், கொரோனா வைரஸ் when it is முதல்ல பீக்ல ஏப்ரல் மேலாம் என்ன சொன்னோம்னா, கொரோனா வைரஸ் நம்மளை சுற்றி இருக்கு. அப்போ we should not touch any object because it is active for 4 to 5 hours. அந்த மாதிரி சொல்றோம். So any airborne pathogen it will remain around us. Okay. So அது கொஞ்ச நாளா இருந்துட்டு large droplet settle on the ground within few seconds. What is the answer? Observe the picture and answer the question. What will happen if cold affected friend or any of your classmates sneezes or cough? Cold and the flu are common communicable diseases. Communicable disease definition. It is caused not only by bacteria but also by viruses. When you have cold and flu, you may also have another symptoms, running nose, cough, sore throat, and sometimes fever or pain in the joints. For some, this condition may also lead to mild diarrhea. So, நம்ம previous slide ஓட representation ஓட இப்ப cancer இதுதான். Symptoms இருக்கும். Also, secretions oozing out from the nose may contain bacteria or virus. நம்ம previous pictureல பார்த்தோம்ல, red and black dots. அதுதான் bacteria or virus. When the patient touches the nose and some other objects or someone else, the virus is transferred. The patient touch the nose and some other objects or someone else will touch the virus, it is transferred. Same way, when the patient sneezes or cough, the virus comes out with the droplets and become airborne. அப்படிதான் எப்படி spread ஆகுதுன்னு சொல்லு. நம்ம airborne disease சொல்லிட்டோம். This is how it is spreading. Okay. Hence, it is a good practice for the patient with cold and flu to use a handkerchief to blow the nose and also wash the hands often to ensure that they do not accidentally spread the virus to others. நம்ம precaution இருக்கணும். சரி? So this is the answer for the previous picture. என்னெல்லாம்? Secretions oozing out from the nose may contain bacteria or virus. So when the patient touches the nose and some other object or இன்னொருத்தரை தொடும்போது the virus is transferred. So as also when the patient sneezes or cough, sneezing na தும்முறது, cough na தெரியும் இருமுறது, the virus comes out with the droplets and become airborne. I hope you understand. So this is answer for the previous picture. Right? The next one, dengue pathonle, dengue fever, it is spread by mosquito Aedes aegypti. In the binomial name, create a question lab. Okay. So dengue is spread by mosquitoes or Aedes aegypti caused by DEN 1 and 2 virus belonging to the virus type called flavivirus. And usually dengue Egyptian mosquito will bite only during daytime. Right? It decreases the counting of blood platelets of human blood, and it has maximum flight range of 550 to 100 meters in and around the places. In the picture வந்து ஒரு dengue fever mosquito Aedes aegypti. It causes dengue fever. Again, it will bite only during daytime. Nightல கடிச்சாது வந்து dengue fever வராது. Creating question. Okay. The next one, இது வந்து just a picture to show you. This is Mycobacterium tuberculosis causing tuberculosis. It is a bacterial disease, airborne disease. Mycobacterium tuberculosis. அதே மாதிரி இது வந்து Vibrio cholerae. இது airborne disease. இது வந்து waterborne disease. இது commercial bacteria. This boy is drinking contaminated water which contains this Vibrio cholera pathogen. I hope you understand. So this is airborne disease, tuberculosis. This is waterborne disease, Vibrio cholerae. Right? This typhoid, it is a bacterial disease caused by Salmonella typhi. This is Mycobacterium tuberculosis causing tuberculosis. நான் நிறைய தடவை ரிப்பீட் பண்ணிருக்கேன், நிறைய தடவை கேட்பேன் நான், ஞாபகம் வச்சுக்கோ. Vibrio cholerae causing cholera. Typhoid fever in the bacteria on the Salmonella typhi. Okay. And this is hepatitis virus causing hepatitis in the liver. Hepatitis nale liver da. It causes liver cirrhosis. It causing the disease called hepatitis. That is inflammation of the liver. Inflammation of swelling of the liver. I hope you understand. Sorry. The next one is about vaccine. Vaccine and vaccine is a biological preparation that provides active acquired immunity to a particular disease. என்ன சொல்லிருக்கேன், நார்மலி immunity-னா நோய் எதிர்ப்பு சக்தியை சொல்லுவோம் இல்லையா. A person should have immunity by the developed by the immune system by birth. At the same time, nowadays children are given right from day one birth at different stages, different vaccine is given to prevent the diseases. Okay, so that vaccines, example BCG for tuberculosis, polio for polio drops, oral polio drops. Then MMR and measles, mumps and rubella. It is a viral disease, and these are given at early childhood. இது வந்து childhood இருக்கு, இது வந்து childhood to protect from other diseases. I hope you are able to follow this. So vaccine வந்து actually natural immunity and acquired immunity. Natural immunity na by birth we have immune power. Otherwise, it is active acquired immunity. I hope you are able to follow this. Sorry, we'll continue in the next session. Thank you.